Your knees are not hinges. They're shock absorbers. Every step you take, every squat, every jump, every change of direction, your knees sit directly in the path of force. Every year they absorb thousands of impacts. Most people believe knee problems happen because knees become weak. The Shaolin disagreed. And here's what's wild. They believe knees fail because the tissue surrounding them stops adapting. The tendons stiffen, the stabilizers weaken, the joints lose confidence. Eventually, movement becomes cautious, restricted, painful. But strong knees are rarely built through heavy lifting alone. They're built through exposure, pressure, position, and control. By the end of this video, you'll understand 3 Shaolin methods that build knees remaining strong, stable, and reliable well past 40. Let's talk about why most people's knees fail as they age. The first mistake is training movement while ignoring joints. Most people focus on building leg muscles through squats and lunges. The theory is stronger muscles mean stronger knees. The reality is muscles recover and grow quickly. Tendons don't. The tendons, joint capsule, and stabilizers around your knee determine whether force gets absorbed safely or transferred poorly. Train only the muscles and ignore these structures, and you build strength on top of a weak foundation. Then there's the avoidance approach. Avoid deep knee positions. Avoid loading the knee at extended angles. The theory is avoiding stress protects the joint. The reality is avoidance weakens the joint further. Your body only adapts to what it experiences. Avoid deep positions and your knee never learns to handle them. The Shaolin understood that exposure builds resilience, not injury. The isolated muscle training mistake is another failure. Train quads with leg extensions or leg presses. Ignore the smaller stabilizer muscles. The theory is bigger muscles equal stronger knees. The reality is the VMO, the small teardrop-shaped muscle above your knee, controls kneecap tracking. Ignore this muscle and your kneecap moves poorly, regardless of how strong your quads become. The Shaolin trained this specific stabilizer directly. The rushing progression approach is another common problem. Try to build tendon strength as quickly as muscle strength. The theory is consistent training produces consistent adaptation timelines. The reality is tendons adapt far slower than muscles. Muscles improve in weeks. Tendons often require months. Rush this process and you risk injury instead of building resilience. The Shaolin understood patience was essential. And finally, there's waiting until pain appears. Most people never think about knee health until problems develop. The theory is prevention isn't necessary until symptoms appear. The reality is by the time pain appears, significant deterioration has often already occurred. The Shaolin trained their knees proactively, long before problems ever appeared. Prevention is far easier than repair. Every conventional approach to knee health fails because it either ignores the connective tissue structures or rushes their adaptation or waits until damage has already occurred. The Shaolin method addresses all 3 problems directly. Here's the first secret, the Shaolin wall sit. Most people know a standard wall sit at 90 degrees. The Shaolin used a different angle. Position yourself against a wall with your knees at 45 to 60 degrees instead of 90. This shallower angle places enormous continuous demand on your patellar tendon. The tendon must support force without movement, without momentum, without any escape. This is where structural endurance develops. Your muscles will fatigue first, but your tendon learns to tolerate load minute after minute. Knees rarely fail from a single movement. They fail from thousands of repeated movements over time. This exercise prepares your tendon for exactly that reality. Start by holding this position for 30 seconds. Build toward 2 minutes over several weeks. Perform this 2 to 3 times per week. The second secret is the low bow stance. Step into a lunge position. One leg forward, one leg back. The front knee travels deeply forward, sometimes beyond your toes. Most modern fitness advice tells you never to let your knee travel past your toes. The Shaolin disagreed completely. They understood that avoiding positions doesn't strengthen positions. Exposure strengthens positions. Your body adapts specifically to what it experiences. When your knee gradually learns to tolerate deeper angles under control, confidence returns, control returns, strength returns. This is where the connective tissue surrounding your knee becomes stronger, more organized, more resilient. The goal was never avoiding force. The goal was learning how to handle it intelligently. Start with a shallow lunge position. Hold for 20 to 30 seconds. Gradually increase depth over many weeks as your tissue adapts. Perform this 2 to 3 times per week per leg. The third secret is the quadriceps extension hold, targeting your VMO specifically. Sit with your leg extended straight in front of you. Lock your quadriceps completely. Hold this position. Nothing dramatic happens visually. No movement, no explosive effort. Yet most people begin shaking within seconds because this exercise exposes exactly how much stability is missing. The VMO plays a critical role in guiding your kneecap, keeping its movement organized and efficient. When this small muscle weakens, small problems compound into bigger problems over time. This simple hold restores communication between your quadriceps, your tendon, and your knee joint itself. Sometimes the most powerful exercises look almost invisible. Hold for 15 to 30 seconds. Perform 3 sets per leg, 2 to 3 times per week. Here's how to structure your complete Shaolin knee protocol. Train these 3 methods 3 to 4 times per week. Day 1, perform all 3 exercises in sequence. Wall sit first, bow stance second, extension hold third. Day 2, complete rest and recovery. Day 3, repeat the full sequence. Continue this pattern throughout the week with adequate rest between training days. Progress slowly and deliberately. Never force range of motion before your tissue is ready. Never chase pain thinking it means progress. Adaptation rewards patience, especially when tendons are involved. Remember that muscles can improve within weeks. Tendons often require months to show meaningful adaptation. Think in terms of long-term development, not quick results. By week 4, you'll notice improved stability during daily movements. By week 8, your confidence in deeper knee positions increases noticeably. By month 4, your tendons have begun meaningful structural adaptation. By month 6, your knees feel genuinely more resilient and dependable. By year 1, you've built knees capable of handling positions and forces that would have concerned you previously. Nutrition supports tendon health specifically. Eat adequate protein for collagen synthesis, 1 gram per pound of body weight. Adequate vitamin C, which is essential for collagen production. Consider collagen or gelatin supplementation, though consistency with training matters far more than any supplement. Sleep remains critical, 8 to 9 hours nightly. Tendons have no direct blood supply, so they rely on movement and rest cycles to receive nutrients and remove waste products. Adequate sleep allows this recovery process to complete properly. Track your progression carefully. Document your wall sit duration. Document your bow stance depth. Document your extension hold time and stability. By month 2, you'll see clear improvement in these metrics. By month 6, the improvement becomes substantial and obvious in daily life. Here's what I want you to understand. Healthy knees are not built by avoiding pressure. They're built by learning how to absorb pressure, one position at a time, one adaptation at a time, one layer at a time. Train the tendons directly. Train the stabilizers directly. Train the structures that actually support movement, and your knees will remain useful and reliable far longer than most people ever expect. If you're committing to the 3 Shaolin Tendon secrets for bulletproof knees, drop a comment saying bulletproof knees, and let me build a community of people who understand that knee health after 40 comes from training connective tissue directly, not just building bigger muscles. And if you want detailed progression guidance for each exercise, how to distinguish appropriate adaptation from warning signs, or how to continue this protocol for years, hit subscribe and turn on notifications because we're building the most complete knee resilience community on the internet. People who understand that prevention beats repair every single time. The Shaolin monks discovered that bulletproof knees after 40 come from training three specific qualities: the Shaolin wall sit for structural tendon endurance, the low bow stance for deep range resilience through controlled exposure, the quadriceps extension hold for VMO stabilizer strength and kneecap tracking. That's the entire system. That's all you need. The decision is simple. Wait until knee pain appears and then struggle to repair the damage, or train these three methods proactively and build knees that simply don't fail. The commitment is patient. 3 to 4 training sessions weekly, following a structured schedule. That's it. The results are inevitable. From knees that feel uncertain and vulnerable to knees that feel dependable and strong. From cautious, restricted movement to confident, capable movement. From waiting for problems to preventing them entirely. Now perform your first Shaolin wall sit. Begin building knees that last. And I'll see you in the next video.